Well, it is Immunization Awareness Week. How about that? Couldn't come at a better time. Health officials from DHEC, along with Prisma Health, teamed up to remind people to get their shots, even for those not for COVID-19, but other shots that you could be due. News 19's Tai Wong explains.
And where that child may be okay in a couple days, that may mean that Draylon and I get to hang out with the wonderful staff here at Prisma for weeks on end and not knowing what the outcome may be.
Visha Jamison is the mother to 11-year-old Draylon Holmes. Draylon is immunocompromised. Jamison spoke at a press conference held by Prisma Health and DHEC to kick off Immunization Awareness Week.
I encourage vaccinations, not just to protect ourselves against these diseases, but to protect others.
Health officials were encouraging the community to make sure they are up to date on all vaccines, not just COVID-19, especially our younger children. Dr. Anna Catherine Birch is an infectious disease pediatrician at Prisma Health. She says hospitalizations for children have gone up due to the lack of proper immunization.
We are at capacity or near capacity almost every day. Our ICU is full of children with respiratory viruses, and some of those are COVID.
Dr. Birch says the majority of teens who have acute illnesses over the last 2 weeks have not been vaccinated. Dr. Deborah Greenhouse is another pediatrician and says since the pandemic began, they've seen a drop in well visits for children.
If our kids aren't coming in to their pediatrician and aren't getting their well visits and aren't getting their vaccines, and yet now they are going back to school without some of the precautions that were in place in the last year, we potentially are going to be in a whole lot of trouble, and not just with COVID. We're going to start to see some of these other diseases pop back up.
Jamison says getting the vaccine is a selfless act that could save lives.
You know, today it's me and my son, tomorrow it could be you and your family. Think of it from a standpoint of how would I want people to treat me? If I were the one that was immunocompromised, would I want others to protect themselves against something that could potentially take my life for the sake of me and loving me?
Reporting in Columbia, Tai Wong, News 19 WOTX.